Our final speaker today is Peter Munig. Dr. Munig is a professor of health policy and management at the Columbia University Mailman School of Public Health. His research combines randomized controlled trials with cost-effectiveness studies to determine the best mix of social policies so that government leaders can determine how to obtain the best value for their investments. He has studied smaller class sizes, pre-kindergarten programs, lead abatement programs, welfare reform, transportation policies, and health insurance. He has led multiple grants for the National Institutes of Health, and he's published more than 160 studies in leading journals. Dr. Munig received his medical degree from the University of California at San Diego and his Master's of Public Health degree from Columbia University. And today he'll talk about the economic benefits of social policy for health.
Great. Nice to meet you all. I have essentially 4 points to make here today. If I can get my slideshow going, there we go. And the first point is that the health and well-being of Americans is on the decline. And it's not just with Wisconsin, as Pat and Arjun said, Wisconsin is kind of falling to the bottom of the US, but the US itself is falling amongst peer nations. And this is happening in parallel with disposable income. So this bottom line you're seeing is the compensation after health expenditures. That's basically what Americans have to buy cars, TV, trucks, food, all that stuff. The third point is that this economic distress produces psychological stress, as Arjun just sort of laid out very nicely. And telomere length is one example of human aging that's impacted by this chronic exposure to psychological stress. So this is going to be the murkiest point of what I'm talking about today. So I'll go into this in a little bit more detail, this point right here about stress. The fourth point is that as policymakers, you can intervene on this process. So there's levers to pull to reduce stressors, to reduce racial disparities, socioeconomic disparities, and overall stress in society. And as you already know, you can, reduce toxic exposures and accidents and improve neighborhood conditions and things like that too. That's pretty straightforward. So let's get on to this first point. The health of Americans has been on the decline for decades. So this is not something that's happening in other nations. These are comparable country averages. You see that life expectancy increases over time. It's just a natural phenomena. As technology increases and humans change, it tends to improve. In the United States, however, it's on the decline. And we have some guesses as to why this is happening. One is this toxic stress that I'll go into in a little bit of detail in a minute. Another is toxic exposures, accidents. Then, of course, you have neighborhood conditions, things like that. Hopefully, this guy is not in your neighborhood. The way that humans adapted to stress for much of human history as hunter and gatherers was we had this response that would help us survive an attack by a predator. So you see this guy, and you're either going to live or die. And when you see him, what happens is you have this visual image of this threat in your environment, and your body just starts pumping out adrenaline and pumping out glucocorticoids. And what's happening is those chemicals are diverting energy from all the organs in your body into your thighs so you can run and get the heck out of there. Now, we all have experience with the stress response, but in modern day society, it's not about this acute, quick threat that causes the release of these chemicals. It's a slow burn, right? So we have chronic stressors, and this chronic stress is causing wear and tear on our body. Now, this is an example that you're looking at here that we've all experienced. Everybody in the room has had final exams, including my poor students, and I'm not going to put them through this. But final exams are a form of short-term stress that we're all familiar with. Now, in modern day society, we have stress from morning until night, right? but final exams is an especially hard kind of stress. And this is a kind of stress you might experience with poverty. You can't pay your bills. You can't put food on your table for your family. Your automobile is being, repossessed. You've got all these very intense stressors, and it's much more intense than taking final exams. The experience you have with final exams is, well, you don't sleep, you eat junk food, you don't take good care of yourself, and you have this sort of chronic wear and tear on your body. So this is the slow burn that I'm talking about. And one of the impacts from glucocorticoids taking energy from all of your body organs and causing your telomeres to shorten and your cells to rapidly age is that neurons become fragile. And the brain controls everything in the body, including the regulation of your blood pressure and your cholesterol and your blood sugar. And this endocrine control, is part of the whole normal aging process. As we get older, our blood sugar tends to decline. Diabetes, our risk of diabetes increases, blood pressure increases. This is all part of the normal aging process. This process happens much more rapidly to people who are under stress. Now, there's a policy lever that we can pull to fix this. And as Arjun mentioned, this whole process is called allostatic load. So the point is, all of us age. The question is how fast. So let's take a look at this example of a lever that we might be able to pull. Okay, so let's just look at education really quickly and run through this. So educational attainment can do a couple of things for us. One thing is that it can give us a degree, or it can give us learning, hopefully, if we study and pay attention in class. If we just breeze through, and like Jeff Winger in Community, and get our degree, then we end up with still a better job that hopefully provides health insurance and is less stress because we have enough money to put food on our table, right? Another thing that it can do is it can improve cognition, and cognition is going to improve your job performance and get you that promotion and more money. But it's also going to improve your understanding of behavioral risk factors. So people with higher levels of education have much lower levels of cardiovascular disease, cancer, infectious disease, much less likely to die of COVID, for example. And part of that is this stress process here, and part of it is all these other factors like diet, exercise, neighborhood conditions. So education is going to reduce your toxic exposures. It's going to reduce your chances of accidents and crime victimization as well. Why? Because you're going to have more resources to live in a better neighborhood. So how do we make these investments as policymakers? There's lots of things that you could potentially do. I'll walk through some of these in a second, but let's just take a look at one example. So if you look at the United States ranking in education, just as life expectancy is falling and falling and falling over time, our educational capabilities are falling relative to our peer nations in math, sciences, and readings. And the leaders here are nations like Korea, Finland, and Canada. And Canada's a peer nation. They're just as diverse or more diverse than the United States in some ways. Very similar economy, but way up there in education. So what's similar amongst all these countries? Well, certainly the classrooms have different levels of crowding and resources and things like that. But one thing that's very similar across all of these countries is that they don't spend a lot of money on computers and fancy stuff. They just have overhead projectors. They put all the resources into teachers. So if you're a teacher in a country like Finland and you're in a bar, and you meet somebody, they're going to give you their phone number. But in the United States, they might walk away because teachers don't make a whole lot of money here, and it's not a very prestigious profession. So imagine you made it a prestigious profession by increasing teachers' salaries. So this is just a hypothetical example. So if it's true that teacher quality matters, and that pumping up the salary is going to increase competition for the best teachers, then we could potentially move up in our rankings. But the only way we can really know this is through experimental studies. So as I run through some examples of policies that I've studied in my life, I'll give them a rank based upon the strength of what we know. Okay, so what are our policy options? For slowing human decline and aging, we can intervene in schooling, healthcare, income support, criminal justice reform, housing. There's a lot of things that we can do. And where these things intervene in the disease process matters. So primary prevention is preventing disease before it happens. Secondary is getting it early. Tertiary is making sure that it doesn't get bad. So an example here would be EPA regulations would reduce your exposure to carcinogens and therefore reduce the chance that you're going to get cancer in the first place. Mammography or colonoscopy is another way we could spend our money, but that is spending it on something that's already occurred, right? So now cancer is already in your body and you're trying to catch it early. And then the third thing that we could do is try to treat the cancer after it's occurred with cancer chemotherapy. So obviously the most desirable thing is to prevent it. And that's really where you guys come in as policymakers, because you can prevent disease by pulling policy levers. And one way you're going to do this is through the aging process and human stress. And another way you're going to do it is through, reducing accidents and those kinds of things that are much more obvious. So I'm going to run through these. Now, imagine you have a budget of $8 million. And you could spend it on anything to improve the number of lives that get saved with your $8 million. So you could spend it on mammography, say. So mammography is an example of a secondary preventive intervention. It detects disease early. Costs about $8 million to save a life with mammography. So you're going to save one life with your $8 million bucks. The evidence behind the story that I just told you, though, is pretty weak. And why is it weak? Well, it's weak because we can't really randomize women to receive mammography or not receive it and then see if they die of breast cancer. You can only do observational studies. So we really don't know if mammography is life-saving or not. We don't know if that $8 million is a reliable number. It could save many more lives, or it could not save any lives. The major point here, though, is that it's not just mammography in the secondary preventive category that would just save one life. We get similar numbers for treating high blood pressure, cholesterol, and diabetes. Remember, these are medications that we're taking after a disease process has already set in. It's really expensive to do it, also costs about $8 million to save a life. And these drugs come with side effects. You need to treat about 300 people to prevent one heart attack or stroke. For blood pressure medication, and a lot of people have bad side effects from it. So it's quite expensive to do it. Better to prevent it before it happens. But here with these medications, we've got great evidence, multiple randomized controlled trials. That's the gold standard for how we know things in science. Okay, so let's look at a primary preventive intervention. Seatbelts prevent injuries from occurring in the first place. Seatbelt legislation, it's wonderful. Costs $2,790 to save a life. So with our $8 million investment, we're going to have, almost 300 lives saved by investing in seatbelts. We can't randomize people to seatbelts, but we can observe these outcomes under laboratory experimental conditions. So the evidence is pretty good. And it's kind of like jumping out of a plane with a parachute. You pretty much know that it's going to save lives. But I'm going to give that an 8 out of 10 because we don't actually do that in humans, put seatbelts on them or not. Influenza vaccination, about 1.4 million to save a life most seasons. This is based upon randomized trials in humans. So that's a 10 out of 10. We'd save 6 lives. So we're better off spending our $8 million on influenza vaccination than on blood pressure medications, for example, which we only save 1 life. So save, 5 additional lives. That's pretty good. But now we get into the things that will start to reduce stress and the stress response. Income support programs range from cost savings to pretty good deals. One way or another, income support programs are going to come in better than mammography or blood pressure medications, which are things that we're going to do, we've agreed we're going to do. They take many forms, and that's why the range of values is so big. So SNAP is just a basic food stamp program. It's just basically giving people a cash equivalent. But these programs can also get quite complicated and quite expensive. And that's when the programs can start to get less cost effective. Okay, so we have experimentally tested, and I've been a part of these experimental trials as a PI and lead scientist on a number of them, and I've run a number of these studies on older trials as well. We've tested this in humans multiple times. Cash support in one form or another, whether it's to an incentive to get a job or direct giving, is going to increase your life expectancy. It's going to improve your health. And we think that this is one reason why countries like Canada do better than the United States, is because they have better cash support programs that are comprehensive and more centrally focused. So there's not just sort of scattershot programs all over the place, state by state. And that's one reason why Canada is moving ahead in life expectancy and we're moving behind. So we can maximally invest these interventions that save money and lives. So if we look at income support programs that save money and lives, we can just spend, the sky's the limit. It's a return on investment. It's like buying a mutual fund that's going to pay out 20% over the person's lifetime. It's a no-brainer. You just buy it. Restricted housing vouchers are another form of income support in some ways that save money and lives. But this is a different program from traditional income support. Housing vouchers, Section 8 vouchers, will support rents in for low-income families, and they tend to support rents in low-income neighborhoods. Now, if you put conditions on these housing vouchers that say, hey, you have to move into a higher income neighborhood if you want to receive this income, then over the lifetime of that individual, you are going to save money and lives. We have experimentally tested this in multi-center randomized controlled trials. It's very good evidence. The health data comes only from a small subsample of these, but it seems pretty robust and consistent with the economic evidence. Pre-K programs, you all know what those are. They have a lot of advantages. One of the advantage is that it allows parents to work, because this is putting their kids in a school environment during the day. It also takes low-income kids out of an environment that is potentially less enriching than they would have at home for some families, and more enriching for others. But in general, most pre-K programs are going to help kids read and write. And the lowest quartile of families, the children are exposed to about half as much vocabulary as the highest quartile of families. So, and about half as much math. So pre-K programs can really expose kids to more concepts and ready them for schools, while also taking the kid out of the classroom, out of the house, so the parents can work, saves money and lives. We've experimentally tested this, but the results have been mixed. So Head Start is a program with mixed results, but all of the strong early randomized controlled trials where you follow these kids through their lives are very small, but they've shown consistent and powerful results. Nurse Family Partnership helps low-income families with parenting and also provides educational support for the children. saves money and lives. Very similar. This is very well tested, experimentally tested in humans through randomized controlled trials. Medicaid, it may save money and lives, or it may cost up to $1.4 million per life saved. The results on this are mixed. There's one experimental study and numerous quasi-experimental studies. On the whole, I would say the results are pretty darn good, that Medicaid is going to save money and lives. And in the worst case result, it's going to be slightly more cost effective than blood pressure medication itself, which is something that Medicaid has no impact on, is blood pressure over the short term in the experimental studies, but in the quasi-experimental studies, in the real-world studies, it shows that it has big impacts. EITC, something I study as a PI on randomized controlled trials, multi-center, saves money and lives, really produces a lot of health. So we've tested this experimentally and quasi-experimentally, left, right, front, and center, and it saves money and lives. Reducing the number of children per classroom. Now, this was an interesting study, multi-center randomized controlled trial, saves money. It saves money because these kids tend to go off and do better in school. They had better 4th, 8th grade performance. They had higher high school graduation rates, higher college attendance rates, but it also appeared to increase mortality. And the reason we think that this happened was because the kids were more confident and more social. They tended to die from, car accidents and party events, drug overdoses, pool drownings, things like that. So based upon that trial, we'll give it a 7 out of 10. Safe routes to school saves money and lives, making traffic slower and around schools. We only have observational data. Bike lanes come at a very good value. So we only have observational data, but we would save many more lives than we would with blood pressure medication. Slow zones in neighborhoods saves money and lives, but again, not great data. Freeway parks, you can filter the air coming out of freeways by building parks over the top and give people a place to have recreation. Saves a lot of money because it increases property values around freeways. It's projects that can be done in conjunction with developers, reduces pollution, increases opportunities for exercise, but we only have observational data, similar with bike share and pollution. Exercise increases exercise, but we really only have observational data there. And same with congestion pricing, which is charging cars to move into congested urban city centers. Saves money and lives, but the data are pretty weak on that. These are only some examples of studies that have been done, mostly studies that I've done over my lifetime. So just to summarize, the health of Americans is on the decline. And this may be because we are not investing in the right policies. It's not that we're spending not enough money or too much money. Our policy mix is wrong. And we have a lot of levers we pull. We know we can pull. We know which levers we need to pull. More studies need to be done, but we have a pretty good idea of some of the kinds of investments we can make at the state level or the national level that will improve population health in the United States and bring us up more in line with our peer nations. Thanks so much for listening.
Thank you so much, Dr. Munig. That, I think you just answered one of our advisors' questions when we met with them this summer, was that they wanted to know what policies outside of the healthcare system will help them improve the health of Wisconsin families. And so I think that the run through of all of the various social policies that they might consider will be answering that question exactly. If I could just ask one question. So if I'm a policymaker, if I'm a legislator, and I've just seen the list of the social policies, where would you put the money? What are the programs or the approaches that have the strongest body of evidence so that if a policymaker wants to both improve the well-being of Wisconsin families as well as their health, where would you start?
So you start with the things that are, low-hanging fruit, the things that we're very sure work and that we're very sure save money and lives. So expansion of the earned income tax credit would be one great example of that. The earned income tax credit can go higher, and what it is it's a credit for people who are working in low-income jobs. And as their work hours increase, the amount of credit increases, so that when that person files taxes, they get taxes back. It's a program that has a wide bipartisan support. Historically, it's been expanded and supported by Republican administrations and Democratic administrations alike over time. So that's where I would say would be the number one no-brainer place to put money, as one example. But of course, you want to go for this low-hanging fruit first that saves money and lives, and then keep moving up from there until you get to probably in the United States around $8 million per life saved is what we consider a good value.
Excellent. Thank you so much.